LA is part of an ambitious new healthcare program to treat people's illness with food.
Hello?
The $6 million pilot program delivers homemade meals to the doors of low-income patients who are just out of the hospital.
Hi, I'm from Project Angel Food. I'm delivering some food.
As David Gorn of Cal Matters reports from Southwest LA, with these deliveries, California is betting on heart patients to get a lot healthier by eating their medicine.
And so I'm going to get the packages.
Volunteer driver Susan Graham has arrived with both hands filled with bags of food for a heart patient named Sharon.
Okay, come on. Hi, how you doing? Come on in.
So, I have 2 bags for you. This looks like it's all the major foods.
Okay.
Some of them are frozen, so you may want to
Yeah.
put them in the freezer.
Sharon's feeling pretty good these days, walking well, breathing well, just 3 weeks removed from hospital visits for congestive heart failure. It's a condition where fluid builds up in the lungs and around the lining of the heart.
I had water around my heart. Yeah, I had to go to the hospital a couple times, and my breathing was acting crazy. But now I'm cool.
Now, one reason she's better, she says, is because of the week's worth of healthy meals that just arrived at her front door and will continue to arrive for 3 months. It's part of a new state experiment to use diet to improve the health of heart failure patients.
There is a direct correlation between food and in quality of life and health.
That's J.C. Cooper at the State Department of Healthcare Services, which oversees Medi-Cal and is supervising the pilot project, launched in 7 counties for 1,000 congestive heart failure patients.
The hope was that by providing individuals the medically tailored meals, that we would see a reduction in high-cost services like inpatient admissions.
Along with fewer trips to the ER and less need for skilled nursing, because every time heart failure patients regress and go to the ER or get readmitted to the hospital, that's big money, tens of thousands of dollars every time, which makes the cost of these meals look pretty small in comparison. Something simple like helping heart failure patients recover with low-salt, low-fat meals that taste pretty good could end up saving the state millions of dollars. And that starts here, in the giant food kitchen of Project Angel Food out near West Hollywood.
Oh, that's a cute trick I didn't know. Sorry.
Congestive heart failure as a diagnosis is generally an indicator of someone who's going to consume a lot of healthcare expenses.
That's because they go back to the hospital a lot, says John Bacchus, CEO of the LA Care Health Plan, which is helping with the project. He says smaller studies across the country have shown tremendous savings, a 30% or more reduction in costs with the food as medicine approach.
Particularly in Medi-Cal, where dollars are precious, if we can demonstrate that providing nutritious meals to people with congestive heart failure reduces their readmission rates in the hospitals, that would be a great step forward.
Here's the thing. Once California health officials get data that proves food as medicine saves cash, they can expand it. That's the hope of Catherine Couch, who runs the Sonoma County section of the pilot. It could expand to treat diabetes, HIV, obesity, stroke, or for starters, the roughly 100,000 people on Medi-Cal with heart failure as their primary diagnosis.
Say we're able to save 10 million. If you scale that up across the entire state of California, you're talking about a lot of money.
She says this is an idea that could actually go a long way toward fixing the healthcare system. She's sick of seeing medical costs constantly rising.
What we're interested in and what the California State Pilot is interested in is making food a normal part of healthcare, actually making food a healthcare intervention.
And you might want to put them in the refrigerator.
And that makes sense to Sharon, the one who got her fridge filled with a food delivery. She just wants to stay well. And it doesn't hurt, she tells the delivery person as she's leaving, that the meals actually taste good.
Oh, yeah, it's good. It's good to me.
Oh, there's more.
Okay, you guys have a blessed day.
Thank you.
Thank you for being my food.
For Take Two in Southwest LA, I'm David Gorn with calmatters.org.